kick off, and then others can join as they jump in. So, first of all, thank you everyone for joining us today, and thank you to the panelists here. I'm Matt Gudge. I'm the CMO of HealthEngine, and I'm super excited to jump in to this podcast where we'll go through some of the economic trends that we're seeing and really what that means to your practice. And we hope that you leave this webinar with a pretty good idea of what's going on, but also some really practical things that you can take back to your kind of practices or your kind of plans and action accordingly to support your growth and your practice's success. So a wide-ranging panel with some pretty broad experience here. So as mentioned on the CMO of HealthEngine, we've got Michael Evans, who's a partner at MedX Finance. We've got Devika Shivadekar, who's an economist at RSM. We've got Peter Nicol, who's a partner at RSM. And then we're also joined by Patrick Arnot and Charlton Paulsen, who are partnerships and consulting experts from Perfect Practice. So some really broad expertise joining the call today, from financial input all the way down to kind of how you build a practice and some really interesting insights to come from there. So kicking us off is going to be Devika. She's going to take us through a presentation around the macroeconomic trends, and I'll pass to her in 1 second. Just some housekeeping, I guess, jumping in. So this session is recorded, and we will share the recording post this as well. So not only will we kind of share the broader recording with everyone that's joined or registered, but we'll summarize key takeaways so that it's actionable and easy for you to pick up off the back. And if you do ask any questions throughout, there's a Q&A where you can put it in or drop it in the chat. Please throw anything in at the end of this. We'll obviously leave some time for questions. If we don't get to all the questions, we will answer them, and we will come back to you post the webinar with a response to your question to make sure that you feel that you got the most value out of this session. So looking forward to it. Devika, I'll hand to you. Let's jump in.
Thanks so much, Matt, and thank you so much everyone who's attending. Thank you for your time today. I'll get started. So let me walk you through how the Australian economy has been faring over the last couple of years and where we are currently, and how that plays, how I intend to take this presentation is I do a deep dive into the economics of the country. We move into the healthcare sector, and then we move into how these economic factors are impacting healthcare practitioners. So to begin with, just a quick overview of what has been happening. Of course, we are all aware that Australia has successfully beaten a recession. We did see across a couple of our global peers that they did face a recession coming out of the pandemic and in a high interest rate environment. But Australia has so far held up well. Sequential growth is standing at 0.2% as of the second quarter 2024, which has taken the annual growth to 1%. Having said that, we are still in a per capita recession, which broadly means that overall, as a country, we are doing well. There has been no economic downturn, but individually, as Australians, our standard of living has suffered significantly. What is it that actually supported our country through the pandemic and coming out of the pandemic was excess savings? We are all aware that most of us everyone was essentially working from home for close to 3 years. There were a couple of lockdowns, all, of course, with good intention to make sure that we are all safe. What that meant was our expenditures were at an all-time low, which meant that while working from home, the salaries we were earning were simply sitting in our bank accounts. To just give you a bit of a perspective, historically, Australia's household savings ratio has been at a 5% mark. But during the peak of COVID, those 3 years from 2019 to 2021, we saw that household savings ratios had jumped as high as 25%. So that was massive. And coming out of the pandemic, once the lockdowns were lifted, we all wanted to go out. We wanted to travel. We wanted to eat out. We wanted to meet our friends. There was a lot of retail therapy going on at individual levels. So what that meant was there was a lot of economic activity going. There was a lot of purchasing. There was a lot of selling. And that pretty much supported our economy domestically. Externally, at the height of the pandemic, our our core commodities that we export, which is our external sector, export of iron ore completely exploded. Prices went through the roof. So there was a double victory for us. Domestically, robust consumption, externally, extremely good commodity prices, which meant our GDP numbers were quite robust. Along with that, of course, we had a very strong job market, which meant a lot of people were earning healthy incomes. Now, on the flip side, what that meant was Australia was fairly shielded from the detrimental effects of the pandemic. Because of our extended lockdowns, our death count was extremely low compared to our peer nations. That that kind of gave us the opportunity to open up a lot sooner than the rest of the world. However, what that did was the demand for goods and services from Australia completely outpaced the supply of goods and services that were entering Australia from our trade partners, simply because our trade partners' borders were still closed. Now, Economics 101 tells us that when demand outpaces supply, we have the problem of inflation. Prices start rising really fast. And that is what brought us to a 7.8% year-on-year price growth, as we saw in December 2022. Currently, we have almost halved the pace of growth in prices, and we are currently sitting at 2.8%, which is at the top end of the RBA's target band. Trimmed mean inflation, which is core inflation, is still higher at 3.5%, primarily led by services inflation. Now, you would wonder, why is it that services inflation is still sticky compared to goods inflation? Goods inflation predominantly relies a lot on goods entering Australia from our trading partners, whereas services inflation is more domestically driven, predominantly by the labor market. Now, what's happening in the labor market is our unemployment rate is sitting at multi-decade lows. We are still sitting at 4.1%, which has been a historical low by Australian standards. And surprisingly, we have been adding a lot of jobs over the last couple of months. What that has meant is there is still a risk that inflation may not come down sustainably, simply because of the point we discussed earlier, that the more people in the jobs market, higher the potential to earn wages. Once you're earning more wages, you demand more goods and services. And if supply is not able to match those goods and services demand, we have the problem of inflation. Please bear in mind, inflation is not prices. Inflation is the rate of change in prices. So the more you demand, the faster prices grow, which is why it's very important that demand remains a bit moderate. Now, let's see how the healthcare sector has been faring overall. So the care economy, as we call it, the healthcare sector is a force to reckon with in Australia's GDP metrics. It contributes almost 13 to 14% to Australia's GDP and is undoubtedly one of the greatest employers in one of the greatest avenues of employment in the Australian economy. If we broadly look at the public-private healthcare, aged care and pharma business, overall annual expenditure in this industry from the government's purses is close to 220 billion Aussie dollars, which is massive and one of the largest. Growth rate has been a steady 3.5%, around 3.5%, let's say 3 to 4% mark. And it's primarily being driven by an aging population. Now, that is also an area of focus today, where we are going to touch upon the fact that demographically, as Australia's population continues to age, the reliance on the healthcare sector is going to exponentially grow. Of course, medical advancements are a big feat for us. We are in fact growing fairly strongly in advanced medical technology. As more and more newer technologies reach Australia, we are likely to become more and more efficient in delivering these healthcare services. Government spending, of course, 2/3 of healthcare funding supports public hospitals, Medicare, and the pharma business as well. I'm not sure if you see, but everyone must have filed their income tax very recently, and you may have gotten a letter from the ATO with the notice of assessment and where your money goes and how it goes, and you will see that healthcare is right at the top, followed by rest of the metrics. So healthcare sector, of course, spending is massive from the government side, and we as taxpayers, of course, contribute our share. Private health insurance covers about 45% of the total healthcare needs and makes about a $25 billion contribution to the overall economy. And like I said, 20% of the Australian population is expected to breach the 65-year mark, which is when they will be considered senior citizens by 2030. So that's obviously hints that demand for healthcare is only going to be increasing over the next 5 to 10 years. Just to give you a quick overview of how healthcare workers have been growing in Australia, we are all aware that the government is pursuing more and more avenues to bring healthcare workers from abroad, while at the same time to support the healthcare practitioners already in Australia, simply because demand has been outpacing and the care economy, the healthcare sector has been completely overstretched. In fact, it's fair to say that this sector has always been a bit overstretched, but the pandemic completely just exacerbated the problem that was already there, and now we are finding it a bit difficult to really get everything back to speed. So we have been relying a lot on bringing health practitioners from outside of Australia into Australia to support our needs. As you can see, allied health has shown significant jump in the number of health professionals coming to Australia from 2013 to 2022. Overall, we've seen almost 100,000 number of professionals increase over the last 10 years. Dental practitioners, the number has not increased as much as we can see in allied health, other practitioners as well as nurses and midwives, but that explains that why the demand for dentists is never ending. It's always inelastic, and they are always in demand because we just don't have enough dentists. Broadly, to give you some numbers, healthcare and social assistance growth, employment has increased by nearly 50%. That is massive, and it's reached 2.1 million in 2022, whereas overall workforce expansion has grown by 21% and currently employs almost 14 million workers. That's massive. We discussed how the healthcare sector has fared, what it means for the Australian economy, by how much healthcare professionals in Australia have grown. But let's touch upon how patient experiences have been throughout the years. These are the latest numbers from the Australian Bureau of Statistics Patient Experiences Report published in July 2024. In fact, this one's come out very recently. This is a November publication which covers the time between June 2023 to July 2024, which is the financial year 24. So key statistics here show us that 10.9% delayed or went without prescription medicine due to cost, 20% delayed or avoided mental health care due to cost, and only about roughly 65% of people could see their preferred GP on time. I would like to draw your attention to a common factor in the key statistics. If you see, both the reasons where medical help was not sought or was delayed was due to costs. You can see that GP visits were about 82.6% of the total people surveyed. Medical specialists were approached by 39% of those surveyed. Dental professionals, 50%, whereas hospital ED visits were around 15% mark. I would say this is a good metric that GP visits were higher than ED visits, which means perhaps the situations were not that dire and the principal care providers could easily manage the situation. Waiting times at GP appointments, 28% waited longer than acceptable. I think this is a fair experience which all of us have experienced at some point or the other, where we do have an appointment, we do go to our GP, but we invariably end up spending at least 30 minutes more than we would have liked to wait. But given that how stretched they are for their time, I think it's a given that 30 minutes on average is the waiting time to meet your GP. Specialist appointments, of course, there was a similar waiting time, and the percentage of people who actually waited longer than acceptable was just a tiny bit more than the number of people who waited to see their GPs. Barriers to access, most important factor, which I'm sure all of our audience today can relate to. Cost is a significant barrier. A lot of patients have been saying that they are not able to focus on their health or access healthcare simply because they are overburdened by the problem of inflation and by the problem of higher interest rates, where the mortgage repayments have suddenly shot up. So it's a choice between being able to keep your home or meeting your GP. If you are able to maybe there have been instances where patients have reported that we chose to try some home remedies because we couldn't afford to go to a GP because our mortgage repayments are really high. We are running behind on our mortgage payments. So it's a choice between having a roof over your head or being able to actually see a care provider. Longer wait up there have been instances when people have had to wait a lot longer in disadvantaged areas. Now, disadvantaged areas do not necessarily mean where there are no facilities, but this should be seen in a broader perspective of perhaps regional areas where they tend to travel more to a bigger suburb, which tends to cover these little regional towns under their umbrella because they don't have their own setup at some point. And of course, there's less likelihood of telehealth consultations. I think personally as well, I would say I prefer to see my GP in person than perhaps be able to be on the phone. Particularly if it's something physical, if the symptom is highly physical, where you would really like to be evaluated, I think there's always a preference for a one-on-one appointment over a telehealth appointment. On the good side, positive experiences have been reported more than 60%. That is more than half. Of course, those numbers can be improved, but it's by no means a bad number, particularly when healthcare professionals are so stretched. So clearly they are doing their best, and that is being translated in patient experiences. Highest ratings have been for dental professionals, where satisfaction rate was almost 90%, whereas lowest ratings were for ED doctors and specialists at about 63%. Which again, I would say is not really a bad number given the amount of work they have to do. Actively managing health, self-management, like I discussed before, it's coming. I believe self-management, there's two ways to look at it. Number one is obviously people who believe they are in the prime of their health, or they are in a situation where they are able to manage their problems, their symptoms on their own, based on their research. Secondly, it's of course not being able to get the appointments at the desired date at the desired time, but of course it helps if you are in better health. I think the ratio of people who responded that they were able to manage their health better was people who were already in excellent health and they didn't really need to rely on their principal care providers. Social support for health. About a quarter of people surveyed did agree that they had social support when it came to health matters, more so among younger people and higher income households, which means that 75% are the people who did struggle to find some social support for their health concerns. And it would be safe to assume that those people were probably in a middle age to higher age bracket and somewhere in the middle income distribution. Engaging with healthcare providers, 33% always found it easy, always found their care providers approachable, and a higher engagement was noted among older adults, obviously because they need, it's a very safe assumption to say that older adults obviously need a greater number of engagement. Therefore, their responses would be much higher than people who are comparatively younger. And navigating the healthcare system, a quarter again almost found it easy. Of course, given that there's more support for the elderly, they found it a lot easy to navigate the healthcare system. Services were more readily available, engagement was greater, and of course, those with a sound sound mental health, obviously the ease was a lot greater than those who needed some help in the mental health space. We have discussed what the economy has looked like. We have discussed what the healthcare sector contributes to the economy. We have also discussed what patient experiences have been, and we did find that cost has been the number one problem the number one barrier when it comes to accessing healthcare. Now let's look at what is driving those concerns and what has been the cost barrier predominantly. We are all aware that the Reserve Bank of Australia has embarked on a hiking cycle beginning May 2022 and has raised interest rates by 425 basis points to date. Currently, we are sitting at 4.35%. Initially, the RBI used to meet 11 times a year. It's been slashed. They are now meeting 8 times a year, 2 times per quarter. Now, we did discuss where inflation numbers are. We saw a peak at 7.8% year on year in December 2022, and currently headline number is sitting at 2.8%, which is just at the higher end of the desired target range. Whereas the second mandate says that the RBA has to manage full employment. Now, given that unemployment rate has been at a historical low of 4.1%, and we continue to add jobs, the labor market is still extremely tight. So the risk is still on the upside for inflation, because inflation is yet to reach the mid of the 2% to 3% band, which is at 2.5%, and unemployment rate has been at historical lows. So there's still some time before the RBA can actually consider cutting interest rates. Looking at the chart, you will see that the red dotted lines are what represent the RBA. If you will see that RBA did hike a lot less than our global peers, but please make a note that RBA also started hiking a lot later than most of our global peers, simply because if you look at the US Federal Reserve, if you look at RBNZ, Bank of England, or the ECB, everyone had pretty much factored in a recession into their forecasts as a result of increasing interest rates. Australia, on the other hand, Reserve Bank of Australia, on the other hand, pardon me, has been absolutely resolute on beating a recession. They have been very firm that they do not want to lose the labor market gains. They are happy with how strong the labor market is because they want to desperately beat a recession. They want to walk that narrow path between handling inflation and handling a recession. What that means is we cannot hike as high as the rest of the world. Therefore, we cannot cut as fast and as much as the rest of the world. So safe to say that we are probably going to be experiencing higher interest rates at least until mid next year. A safe bet, just yesterday we had the RBA meeting minutes of the November meeting published, where the RBA board feels that they need to say more than 2-3 quarters of sustained inflation coming down before they can actually consider a rate cut. So safe to say we should expect the first rate cut somewhere during middle of 2025. Till then, patients, healthcare professionals, and generally every single Australian is going to have to factor in a high interest rate environment. Now let's take a look at what this means for the healthcare sector. Now, the biggest impact on the healthcare sector, particularly the healthcare practitioners who have joined us today, is that it means you are going to end up borrowing at a much higher cost than you would ideally like. Interest rates are high. Banks are very keen to pass on those interest rates to every single borrower. And of course, we all know that we do not have the luxury of an extended period of fixed mortgage rates. We invariably do end up on variable mortgage rates within a year or maximum 3 years. So higher loan costs are an issue, is something that you should be factoring in. Of course, not just for equipments, but general facilities, higher building costs. Now, this takes us back to the labor market angle. We discussed how labor market has been really tight, and it has been particularly tight in the construction sector because there has been a chronic shortage of laborers to actually assist in building projects. And those that are already available are completely stretched between the public infrastructure space and the private infrastructure space. On top of that, because there's a chronic undersupply of housing, which is driving up housing prices, a lot of the laborers are now being directed into the housing sector, into the residential construction space. So now you've got a small cohort of people who are completely stretched. A good chunk is in the public infrastructure space. A good chunk is being directed towards the housing market. So that leaves very little for commercial or, in fact, anyone who wants to get into the real estate market to build their new practices. On top of that, what that does is once the supply of laborers is short, it means you have to pay top dollar to be able to hire whoever is available, because they will always be gravitating to where the money flows. Now that adds on to your labor costs. Non-labor costs include costs for raw materials. Raw material costs have also been going up simply because freight costs have been going up, and all the material that is coming from outside of Australia obviously is a lot pricier. Thirdly, increased staffing costs to retain skilled workers. Like we discussed previously, not just for construction workers, but the demand for healthcare workers is so sharp in Australia that there's a fierce competition between different practitioners, different healthcare providers. So in order to retain good doctors and good nurses and good midwives and good healthcare providers in general for your own practice, get stuff until and unless you are able to increase costs to match what is actually currently competitive in the market. Limited, that means when your labor costs are high, you have limited means for expansions or upgrades. And of course, we did discuss the interest rate, interest rate point of view, where on the patient side of things, because they are having to pay extra money towards their mortgages, they are not really able to come and access the healthcare services as much as they would like to, which means the flow of patients to you is going to be a bit subdued. Overall, challenges also include just broad challenges, then include routine overheads such as rents and supplies. Now, particularly those practitioners, we understand that because of the macroeconomic environment where we've seen the challenge of inflation, we've seen the challenge of high interest rates, a lot of the practitioners have been forced to move from bulk billing to private billing simply to keep the practices running. That is the need of the hour to actually be. Now, the challenge for them is you want to keep your patients, you want to provide the services to those who are in need, but there's absolutely no way to do that in a bulk billing in a public space because that's already overstretched. So you move to the private billing space to make yourself more accessible. But what happens is in a high interest rate environment, obviously, is that a lot of patients then are perhaps not able to afford it. Now, without steady government payments, which happens if you are covered by Medicare, income tends to vary a lot, particularly for those practitioners who have moved from bulk billing to private billing. So unfortunately, people who have moved to private billing have been suffering on both sides. On one side, they're seeing the challenge of attracting more customers, but not being able to do that because they are not able to pay that excess cash given high interest rates and high inflation. At the same time, government support is not as much as it is in a public healthcare space. Extra administrative tasks, of course, for direct billing, therefore higher costs broadly for your business. And what that is resulting in is a lot of patients are now going to the ED, the emergency department in public hospitals, simply because they think, okay, we'll just go there, we'll just sit there for a number of hours, but we'll get there, we'll do it for free. So unfortunately, despite this being the most logical move, the healthcare providers who have moved from the bulk billing space to the private space are the ones who have been impacted the most in this current macroeconomic environment because of inflation and because of higher interest rates. I think I would like to wrap up now and pass on to Matt by saying that these are some of the greatest challenges that we are facing. And I think these challenges are likely to persist at least for another 6 months until and unless the RBI actually decides to start easing interest rates. So that is something that you should be factoring in when considering strategies for your practices. And now I would like to pass on to Matt and the other panelists who can help you with some more bespoke strategies. Thanks, Matt.
Thank you very much, Devika, for that. That was awesome. Super insightful as always. I think I listened to that and I think there was probably three big things for me as I took that away, which is, demand is on the up. So if you're a practice owner or in the game, aging population definitely going up. I think you mentioned some really interesting things, which matches the data in our health index report as well, which is there'll be a backlog of people coming forward as cost pressures alleviate too. I think expanding on your point around kind of pressures, about 60% of people delayed a GP visit, about 53% delayed dental, 42% delayed allied care, and nearly 50% of people are living with a condition in Australia, and 30% of those are pushing out medicine purchases due to the cost. So it's kind of, that sounds super negative and it's not great for patients out there, which is your balancing point around aligning kind of the patient price issues, but also practices facing those same price issues. It's a really tricky balance, but it does mean that there is this kind of backlog coming. So as tense as the environment is, it does kind of lean towards demand being on our side. Costs are going to go up. I think to your point, we've got a pretty stagnant RBA for a while, and we're seeing that across everywhere, from starting a practice all the way through to running it, and everything in the middle. So making sure we've got the strategies, which is the perfect time to talk to some of the panelists here to manage those cost bases and look at cash flow accordingly. And then the people and talent market is just fascinating, is it? The lifting of or shifting of visas to hopefully alleviate some of that pressure will be really interesting, but it is an ongoing challenge for us. So a really interesting piece of work, and thank you so much for putting the time. With growth on our side, though, let me take this time to pass over to some of our panelists. I think Michael Evans, take us away. It seems like money's on the mind. So give us your thoughts.
Yeah, definitely. I mean, and it's just been a conversation that's obviously been super prevalent over the last couple of years with what's been happening with rates and, people trying to gauge, whether to go ahead with projects or not, or whether to delay them or whether to bring them forward. And I think rates have been stable now for a while and there's some extra confidence there. On the flip side, like Devika was saying, rates have been high for such a long period of time that obviously from the perspective of funding these new practices, whether it's, medical or dental or veterinary, the core issues restricting it is, the unknowns, the costs, the rates. Also that staffing piece is huge at the moment. So many of our clients are wanting to, be able to grow, and they had expansion plans, but they've actually, struggled with staff, whether it's other doctors or whether it's just skilled staff to actually be processing the administrative side of things correctly. So I think, look, overall, with commercial, residential is obviously a very different matter where we're always looking at income versus expenses and how people have been, operating. And the only time that will really involve residential lending in any way with commercial is in terms of assessing if there could be anything done with the structure on that side of things. But with commercial lending, more than ever, it's important to have the right advisors, be talking to the right people into really early on in the piece about, what is it going to look like? Do you have those things organized? What's the return on investment going to look like? And, how long is it going to take you to break even and get to that profitability point of view? And, on the flip side, I guess we have a whole heap of operators that, especially at the moment, are looking to, assess things and try and get into the correct space before we do see rates drop and a potential, influx of extra competitiveness to get those good spaces for, purchasing property, doing the setups. But I think at the end of the day, it's really important to have those conversations up front, have builders that have done it before that you trust if you are going to do, a setup or expansion, and have really solid advice up front, because it's still very doable. Like we have lots of people that are going through this process, but it's really important to have the right, be going into things with eyes wide open. Banks can still be lending really aggressively at the moment, as well as non-bank lenders. It's definitely more important to show that, you have done your due diligence and that it's going to work. But if things are presented in a certain way, there's still a lot of opportunity out there. There is just, I guess, a bit of a restriction, at a macro scale, like Devika was talking about. So you have to work a little bit harder, I think, to make it make sense, and show yourself it's going to make sense. So, you can have the confidence to take that step with setting up or growing.
Great. Perfect. Thanks, Michael. So get the right people around you, and really consider the structures on the way through. I had a personal question on this one, actually, Michael, just as I think we're all thinking the same thing. Are we seeing interest rates loosen with lenders at all? We've been pretty static from an RBA perspective. Are the banks keep pushing, or kind of what's happening in that space?
It's funny, and it really depends on if we're looking at like residential or commercial lending. There's been a lot in the news from the banks about compression on margins. But if you actually have a look at what new rates are being offered, for example, on home loans from the end of last year to today, although there's been no announcement of rates rising, so obviously the RBA cash rate is flat, what we have seen repeatedly multiple times is, from one week to the next, all of the major banks providing less of a discount on the pricing, on the rates that they're offering for new business or for refinances, and taking away cash back. So without the cash rate changing, they're not offering the same discounts on new business, on residential lending, to increase their own margins out of cycle without having to announce it, by just playing with the standard rates they have, reference rates they have in the background. Commercial lending, I would say, for doctors is still very competitive, and probably even more so at the moment with the squeeze on residential. Banks come in and out of, certain banks, especially the big ones, come in and out of being really aggressive on the commercial side for healthcare. But we're seeing some really aggressive stuff at the moment.
Okay, great. So find the right lender is critical too. It sounds like a perfect time. I'll pass to Peter now, pick up on kind of where Devika left off, and give us your thoughts and the key takeaways.
Yeah, thanks, Matt. From basically what Devika's saying is I think things are still going to be tight for a fair while moving forward. Although interest rates may come down next year and halfway through the year, there's still a lot of, I suppose, demand in the system, and there's a lot of costs already built into the system from a clinic perspective. So, the government's unlikely to significantly increase health spending, I think, despite an increased population and an aging demographic. Interestingly, one of the statistics was it 15.3% of people surveyed are going to the ED departments. I think we're likely to see that increase, because ED presentations are considerably more expensive on the health system than a GP as being the primary caregiver. So that may, as that increases, as the prices increase everywhere else, that may see the government probably refocus back on the MBS and the GP clinics to be primary healthcare providers. I'm not sure how they're going to do that, but I say that they're going to have to, because of just purely the burn on revenue turning up to an ED department for essentially what's a cold or a minor cut or something that you can go to your GP for. So visa changes are probably going to be very interesting moving forward, because at the moment, we're seeing a reduction in doctor number. We're not seeing any growth in doctor numbers per capita, are we? So as the population gets older, as we get more and more people in Australia, we've got more and more compression around those services being demanded by people with the same number of suppliers. So as was mentioned earlier, supply and demand, it's going to see an increase in price. I think from a clinic perspective too, you've seen that over the last few years, where the management expense ratio has gone from 45% down to 30% as there's an increased demand for more doctors. So practices are having to pay for that. There's only really a couple of ways people can run their clinics better, and one of them is to either increase revenue or reduce costs. And if you look at the costs that are involved, a lot of them are quite static, or you're a price taker. in the market, you're not really going to be able to influence outcomes in relation to your electricity bills, your medical supplies. And interestingly enough, the service part of, as in the human capital part of the business too, I see is going to be remaining expensive for a considerable amount of time. So then what's the other option you've got is you've got to increase prices. And, a lot of doctors, they're not there to make a fortune, but as you swing over to, I've got to run an efficient clinic. Yeah, we've got that, but I've still got to be able to keep the doors open. So that is putting an increased pressure on them to actually to either move from bulk billing to private billing, which represents an increase in cost. And unfortunately, it's the only way to keep the door open in a lot of places. So there's little room. I mean, what the clinics need to start looking at is how they bill. They're billing more appropriately. There might be some combination billing that they can do. Might need to engage more nurses. I think Devika can correct me, but I think there's some visa changes in relation to nursing as well as doctors. So the government is looking a bit more holistically about, we need more doctors. Well, yeah, we need more health professionals, and doctors aren't the only answer. There's a lot that nurses can do in a clinic to help make the clinic run a lot smoother, a lot more efficiently. And hopefully that starts to change as more and more people move from overseas. I mean, globally, that's not going to be much of an answer for those countries they move from, but it'll certainly help Australia.
That's great. Thanks very much, Peter. That's good for Australia. So that's a win. Cool. I'll pass to Patrick finally on this question as well. Patrick, just give us your summary on kind of the macro environment, and then we'll dive into the kind of key takeaways.
Yeah, thanks, Matt. I guess for myself, with key takeaway would be that with the current economic climate seeming like it's trending in the right direction, and with what seems like blue sky ahead towards the middle of next year, what we've seen is a bit of an uptick in doctors reaching out to have those conversations that are looking at setting up practices either for the first time or expanding their current businesses. So just to really reiterate the fact and the point to make sure that you're having those discussions with key stakeholders or key partners earlier on in the piece to understand how the current economic climate impacts your new business or your expansion plans. And that does include, from a design and construction perspective, we'd ideally like to be involved early on in the piece so that we can start providing feedback on site conditions and different sites to make sure that you understand potential risks with certain sites. It is an important thing to get right. And if you don't get it right, there can be cost implications and from a timing and an approvals perspective as well. So just to make sure that you're having those conversations with key stakeholders as early on in the piece so that you can make a decision that best impacts your business moving forward.
Great. Perfect. Thanks very much. Okay, great. Let's get into the weeds of it then. Moving into what can you do? So if you're a practice owner right now, you're listening to that. It's quite interesting. It seems like there's some really positive trends. There are some key watch outs. But what do I do to win? Like if I'm a practice owner right now, Michael, I'll start with you again. What do I do to win in this environment?
Yeah, I think if we're talking about it at, like a very broad level, I guess it really depends on the practice, right? Like if we're talking, because there's going to be people in here who are at very different ends of the spectrum. I assume, some that are looking at it in terms of whether or not it's the right time to grow versus some that are actually, just trying to maximize what they're doing with, their existing space and are finding it tough, and whose patients are finding it tough.
Yeah.
And I think, what Pete was talking about in terms of like the overall way that things are built and, being really mindful of like the fixed costs is more important for, the latter practice. For the former, who is, doing quite well in terms of the way that they're growing out and they have the ability to maximize what they're doing by looking at increasing the income that's coming in by actually, expanding or going into another project with someone else or, add additional consulting rooms if they've got sufficient demand there, then that is the other way that, those practices are going to be able to look at it. And then it becomes a matter of, well, what space are you in at the moment? Was that the right pick at the time, and is there room to grow and to, you know, better utilize the space, or add rooms, or add services, or you know, look at a second site. If you have the ability to address those like key issues of getting the staff, getting the doctors, and you have the patients because you've built out either, you know, quickly or over a long period of time. It's probably a matter of getting the right people involved to actually look at adding the rooms and the services so that those doctors can come, and so you can have the additional income to come in and offset, you know, these extra costs that you're facing as an owner. So it's a bit of a politician's answer but I think it really depends on the particular, you know, person and the actual practice itself, because, you know, you can always and always should be getting right advice on, you know, the structures and your terms, and are you on like the best offer at the time, you know, for what you have, and rate versus cash flow, different lenders, all that kind of stuff. But I think ultimately how you address the income versus expense line is going to depend on where you and your practice are at. And, you know, because ideally, if you can do it by adding the income and adding a, you know, a big surplus of that by, you know, taking on a project or a second project, then great. But it also, you have to be at the right stage for that.
Yeah. And I'm going to put you on the spot here a bit, Michael, but dive a bit deeper there, because if you're either kind of side of the spectrum, I think access to cash is one of the things that it kind of becomes tricky. You know, whether that's, you know, finances, and there's a lot for doctors and other things in the space that, from a benefit point of view, what are the couple of things that lenders are looking at, or the practices should be considerate of when before kind of engaging someone like MedX, or looking for cash for growth?
Yeah, I mean, it really depends on, so, you know, what are they looking to do and what's their profile? Because, you know, doctors are, in terms of from a broad finance perspective, obviously the offers that are available, you know, can be really aggressive, up to 100% on, you know, everything, or super funds up to 90%. So the gearing can be really aggressive. Banks, you know, how much you might have to put in is so dependent though on your profile. Like a lot of banks will say they'll go up to 100%, but the appetite's not where it's used to be. You know, and there's other considerations to look at when you're doing that, like, you know, borrowing, you know, in the business, and still assessing, you know, whether you've got non-deductible principal place of residence debt. So can you borrow as much as possible, but does that actually work, you know, from a cash flow perspective, and what do the other partners want, and what is the project? You know, are you leasing it? Is it a ground up construction? And, you know, on the flip side of that, if it is something like a ground up construction, what does the builder want in terms of, you know, their cash flow? Because lots of builders are struggling as well, and they might want, you know, a large deposit for a ground up construction, but what is the value of, you know, that project? Because if it's past, you know, $2 or $3 million, some banks, you know, have additional restrictions that come into place with the contract terms and how much the builder can be paid when. So you really have to, as well as doing what I was talking about before with the planning and, you know, getting a projection done, not necessarily saying that you've done it yourself, but, you know, if you haven't, or your finance person or your accountant, whether whoever's done it, you or your finance person or your accountant, that you've looked at it and you've understood it, and that it's actually feasible. So, because there's ways around, you know, putting in different amounts of cash depending on different lenders, but sometimes, you know, ones that are more generous with, you know, allowing you to keep more cash, or providing you more cash, or allowing you to claim the GST on all the stuff you're financing. Some of them will have slightly higher rates. So you do have to plan for the future about, if you do take the more aggressive options, if you need to, how you get out of that in the future. And forward planning, I guess, is the short answer to that slight ramble. But yeah, it's generally still so workable for, you know, medical healthcare setups compared to general business stuff. But you want to plan to get the best out of it at every step.
Great. So know your numbers. It's kind of the critical piece there, which seems like a perfect time, Peter, to throw to you. I know you touched on billing, kind of some nursing opportunities, but, you know, numbers is your world. So give us a snapshot on how to win.
Yeah, certainly is. So, I mean, again, I spoke briefly about controlling costs. Now, the only other real lever we've got is income. the medical clinics. So, one of the things to do is to start using some of the, I suppose, AI tools that are at your hands now. So whether you use AI scripting tools that help you take your notes so you can be more efficient, and not spend less time with the patient, but spend quality time with the patient, get the correct medical outcomes, but you're not stuck doing the administration. I think now Medicare requires you to be with the patient while you're taking your notes, so you can't actually bill while you're taking your notes or doing your notes later. So the time is of the essence, and when you look at, I don't want to sound crass, but when you look at a medical clinic, it's about throughput. So, it's providing quality of care at the end for sure, but it's how efficient you are with your time during the day that will probably determine a fair bit about how much revenue the clinic makes and how much the clinic gets as a management fee, and then how much the owner of the clinic can then pay off the debt and talk to Michael again and get some more debt. There's a few more. There's a couple of programs around too, and everyone should probably know them anyways. Clinometrics and Cubico are probably one of the two most handy ones. And what they do is they basically interrogate, best practice is probably the most common one. They interrogate BP, and the doctor gets a report on who the patients are that are turning up the next day. And then you can start using that information then to actually properly identify the health outcomes the patient want, and then you can integrate with the nurse to provide some of those. So if you get a report in the morning and there are 4 people that are over 75 coming in, well, when was the last time they had their seniors health check? Okay, well, that's something the nurse can help with. So it's about being proactive with the information you've got. Yeah. And then trying to utilise that information to get the best health outcomes for the patient, obviously, but also provide opportunities for the clinic to bill appropriately for the services that are probably generally missed. So you might actually do a lot of those things, but you don't bill them because you might just bill a 23 or a 36, and you go, well, actually, there's a bit more into it than what I did. Whether you look at your DMMRs and start having a look at when the last time you did your DMMRs were, and then refer off to the pharmacist. You can add a lot of value, as well as give yourself opportunity to probably bill more appropriately for the services you provide.
All right. Thanks very much. We'll zoom back a bit to starting a practice or building a practice. We spoke a lot about kind of construction costs or the costs along the way. So, Patrick, give us a snapshot of what they can do with you guys.
Yeah, definitely, Matt. I guess how to win within the current economic climate from a new practice or expansion point of view. If you are considering this type of a project or expanding your business, now is really the time to start having those conversations with key personnel, such as Pete, your broker, and MedX as well, and a fit-out partner as well, because what we've really seen over the past 12 months is a plateau due to the pressure of interest rates. Trades have been a bit quieter due to less consumer confidence. But with the interest rate seeming not too far off, as Devika said, towards the middle of next year, this will create a bit of an uptick in the construction industry due to consumer confidence coming back, which will start to drive up those construction prices again. So essentially, just to start having those conversations earlier, so that you can take advantage of the current time where construction prices are currently plateauing.
Yeah, great. Nice one. Okay, I'm very conscious of time, so I'm going to throw to you again, but give me one thing each, and it's Michael, I'll start with you. If you're starting a practice now, what's one thing you should know going into it?
Going into it, I think if there's one thing, it would be although you want to be, I guess, mindful of, not overburdening yourself initially, also taking a space where you can grow into, to really allow yourself to absolutely maximize what you're getting out of that space and the return on investment on it over time, rather than, getting 3, 4, 5 years down the line and having to look at a second site straight away. It will just save you so much, and it will let you, or I guess the return be so much exponentially stronger that you will be able to focus on, just driving the business and delivering positive outcomes. Yeah, we see that a lot. I think I'd highlight that.
Yeah, so that's a kind of buying bigger and filling early. Is that kind of your?
Yeah, and look, it's a hard balance. And you can't just go and buy the biggest thing straight away, especially if it's your first site. But trying within reason to get something which allows you room to not overburden yourself initially, but also to do well into the medium term. Hopefully, yeah. And then look, it's easier said than done, but there are spaces like that if you have the right people involved as well.
Good stuff, Peter. Give me a one takeaway.
Shortly, cash is king. You've actually got to understand what your cash is doing. And if you're going to open up a new clinic, what's going to happen to your cash is going to go like that, pretty much. So you've actually got to be able to forecast and plan, understand what your cash demands are going to be over the short to medium term, and be able to just cover the bumps.
Yeah,
short and sweet.
Yeah, nice. Love that. Charlton, I'll pass to you. What's the one big thing from a practice point of view?
Things to consider from a design and construction point of view. It's a bit like how long's a piece of string. It's quite a number of things. One of the most important thing that we see doesn't always get taken into consideration is location and the importance of it, understanding the demographic of an area where you're looking to establish yourself, the current demands and needs for your service, and also the competition, particularly important around primary care when offering those services. And off the back of that is design. So we've alluded to the shortfall in HR, the resource point of view. So how do we attract staff and retain them? And then also patients, how do we give them that exceptional feeling that word of mouth and social media and other influences through marketing will ultimately drive business and good outcomes for your practice.
Yeah, perfect. Thank you. And I think I'll pick up on that from a HealthEngine point of view. I think that's our number one focus when we're kind of looking at these things is how do you think about patient experience from end to end? And I think we touched on this right from the very start with Devika is price impacts both sides of the coin from a practice perspective and a patient perspective. And it's such an interesting conversation because I don't want to show price because my competitors may show it. But, this isn't about publishing a menu of pricing, but how do I understand what it costs me to get you in the door? To Pete's point, what's the cash? How much am I paying to get you here? And what's that first service? How do I get you in and how much is it going to cost? Because we see bill shock being kind of one of the kind of key drivers of people delaying those services. So I think from a HealthEngine point of view, it's definitely about think about the patient experience end to end. How do you make it easy for them to book? How do you make it easy for them to show up? How do you remind them so that they do show up and don't miss your appointment so that you're not wasting those times? And if you are wasting those times, how do you fill those cancellations quickly and close it out the back? So I think, finding the right tools. It seems like the summary of a lot of this conversation, just to kind of close out. And if there are any questions, please throw them in the Q&A and we'll make sure we answer them off the call. But please, anyone jump in. It feels like the summary is absolutely know your numbers. Be really clear on cash because it's king and forecast appropriately. Get the right people around you in the room early on, as early as you can, to make sure that you're having conversations with people that can kind of highlight some of the guesswork. Make sure that you're kind of thinking broadly about construction, purchase, financing, and other things on the way forward, and that we're on the up. I think we're hopefully, if we can all look forward to the return of normal rates at some point in the next year. Cost may ease for us, and we may see demand come back pretty rapidly. So it seems like a positive takeaway overall for everyone, and hopefully some key learnings for practices on this call. And that's pretty much time for us there. So the next steps for us, we'll obviously send this recording out to everybody along with presentations so that you can keep up with what we went through today. If there are any questions in that presentation, we'll share the contact details of everyone here. And of course, you can follow up with those directly as well. So I hope this was valuable for everyone on this call. And I really appreciate your time and spending your evening or afternoon with us, depending on where you are in Australia. Thank you again from all of us here. And thank you to the participants here at the webinar. It's been great. And happy Wednesday.
Thanks, Matt.
Thanks, everyone.
Thanks, everyone.